your video accordingly. All right, so this is being live streamed and recorded. Also, we do really want to take your questions. We know that it's not every day that you get to sit down with a doctor for an hour. So we know that you're all going to have questions. We really welcome your questions. However, we're going to take it at the end. So as Dr. DeRose is speaking, we want to encourage you to just type your questions in the chat box. And after he's done, in about 30 or 40 minutes, and we will try to get to as many of them as we can. Okay. And also importantly, please note that this is for educational purposes only. So the presentation is not designed to diagnose or to treat your specific health condition. All right. So before you apply any of these things, please speak with a healthcare provider. All right. This presentation is brought to you by two organizations. One is Lifestyle is Medicine, which is a non-for-profit organization that seeks to run lifestyle medicine programming for the community, especially in the Toronto area. And also Pathways to Wholeness Lifestyle Medicine Clinic, which is a group of lifestyle medicine and naturopathic clinics servicing the greater Toronto area. So we really thank our partners for that. Okay. All right, so today our topic is hemorheology, right, which simply is the study of the characteristics of the blood. And even when I went to medical school, it's not a topic that I even learned about, but it's actually something I heard first when I listened to one of Dr. DeRose's talks. But I think we could all appreciate, at least just from common sense, that to have a healthy body, you have to have healthy blood. And so we want to really break that down for you today. Our speaker today is someone who is eminently qualified to speak on lifestyle medicine and these topics is Dr. David DeRose. He has a master's in public health, and also he is a medical doctor. He's board certified in internal medicine and also board certified in preventive medicine. He formerly worked at Weimar Institute, which is a lifestyle immersion center located in California, and now he's with Compass Health Consulting. All right, so we really welcome Dr. DeRose to the program. He's written several books, including one on blood pressure. So it's 30 Days to Natural Blood Pressure Control. He also wrote a book on evading Ebola, and his most recent book, The Methuselah Factor, which will be the topic of our discussion today. So Dr. DeRose, we really thank you for coming on the program. And just to break the ice, you wrote a book called Evading Ebola. I wonder if you can write a book on COVID.
We actually thought about doing that because a lot of the things that we talked about in there are really cutting edge, but instead we decided to give the book out free. I don't know that it's still being distributed that way, but early in the COVID epidemic, we were giving out free ebook copies. If someone does want a copy, I think it may still be available on our website, which is compasshealth.net. If not, you can reach out to me through there and we can get you one. Pretty simple book, but just talking about lifestyle things that improve the immune system. We talked a lot about inapparent infection. It's a big topic today with COVID, but it was a topic with Ebola that no one talked about. Literally, probably thousands of people have had Ebola and never got sick. So now we're all very aware as a public that you can have asymptomatic infections, but we were really talking about it 5-6 years ago with Ebola. And the real good news is that good immune systems protect you from a lot of things.
Including COVID, right?
That's right.
Yeah, okay. Well, I'm going to stop sharing my screen, Dr. DeRose, and I'm going to give it to you. So thank you so much for coming. And again, for our listeners, please put your questions in the chat box so we can get to as many as possible. All right.
Well, it's great to be with each one of you. And it's an exciting topic that we can be talking about the subjects that really are important to each of us. And George, make sure that right now I've got a message, host disabled participants screen sharing. So either make me a co-host or help me out here so we can get the PowerPoints up.
Yep.
So basically, by way of background, we're talking today about hemorheology, the science of blood fluidity. And when I speak to lay groups about it, I tell them it's really something that the medical research suggests can help us literally turn back the clock when it comes to diseases. And whether you talk about healthier blood, whether you talk about harnessing hemorheology, we're talking about the science of blood fluidity and what it can do for you. So let me just talk a little bit about this whole concept, what it is and why it's so important. Hemo, of course, comes from a root that refers to blood, and rheology basically refers to the science dealing with the flow properties of any kind of matter. So when we put hemo in front of rheology, we're talking about the flow properties of blood, very literally. And it's the science that's looking at how effectively your blood is flowing throughout your circulation. You say, well, obviously that would be important, but just how important is it? That's really the subject of literally thousands of papers, medical societies, books, lots of research. Years ago, someone was speaking about hemorheology in the context of lifestyle medicine. I know we think that's a field that really just emerged recently. But this author who was promoting healthy lifestyle practices said perfect health depends on perfect circulation. This is over 100 years ago. And I can imagine someone reading this saying, oh, well, this is just beautiful poetry. What I would suggest to you is this is cutting edge medical science. If we improve the circulation in our tiny blood vessels, we can actually dramatically improve health. So George mentioned that our recent book came out last year, The Methuselah Factor. You see the subtitle, Learn How to Live Sharper, Leaner, Longer, and Better in 30 Days or Less, is really a distillation of the medical research on hemorheology and how we can make it practical. So I'm going to try to take a real quick bird's eye view of the book. Just briefly, the layout of the book is what we're going to use tonight. So the first 14 chapters go through the science as to why hemorheology is important. And I've got a copy of the book right in front of me. Just opening up to the index here. So we talk about why it's important for preventing stroke and heart attack, why it's important for preventing blindness. You say, you don't need the book. You're just going through figure one. That's exactly right. So each of the chapters, the first 14 chapters in the book, we walk through this list that you're seeing projected, how improving blood fluidity can decrease your risk of all of these major causes of either morbidity, pain and suffering, or mortality. And a lot of people look at the list, they say, well, sure, stroke, heart attack, those are circulatory diseases. But what about blindness, cancer, cognitive decline, going down the list, physical performance? How are all of these things related to blood fluidity? If you've got specific questions about any one of them, we can discuss it in more detail, but I just want to give you the bird's eye view in this presentation tonight. Let's look at a few examples, and I think if we look at these, it'll help us understand a little bit better just what we're measuring, just what we're looking at when it comes to blood fluidity or hemorheology. And some of you might say, well, yeah, you've been talking about hemorheology, but why this weird name for the book, the Methuselah Factor? Some of you may have heard the expression as old as Methuselah. It actually comes from the Bible. The oldest live person, the person who lived the longest on this planet, according to the Bible, was a fellow by the name of Methuselah. So I like to say, well, we may not have any blood work on this guy, but if he really lived the longest, then we can be pretty certain that he had good hemorheology. So for the benefit of lay audiences over the years, I've been speaking on this for some time, I said, you can just call it the Methuselah factor because it's something associated with longevity and optimal quality of life. So back to stroke. What does stroke have to do with blood fluidity? Really interesting stuff. This is a study. I just want to look at one study with you that we cite in the Methuselah Factor book. Some 15 years ago, they took a population of some 300 individuals who had a history of either a stroke or a TIA. And I think many of you know that's a transient ischemic attack, kind of like a mini stroke, goes away by itself, usually in a matter of minutes, but looks just like a stroke. So in other words, you're looking at some 300 people who have evidence of circulatory compromise to their brain. They compare them with 73 healthy people. What did they find? Well, what they found is these different measures, and by the way, these figures are actually right from the book. they found that these 4 factors that are, by the way, determinants of blood fluidity, determinants of hemorheology, actually all correlated with a greater risk of having a stroke or a TIA. And I just want to walk through these because it helps us understand what factors contribute to blood fluidity. The first one you see there is hematocrit. Many of you probably have some medical background. If not, you've likely heard of hematocrit. It is the percentage of your blood that is made up of red blood cells. So if I measure your hematocrit and I say it's 50, that means 50% of your blood is made up of red blood cells. The rest of your blood, water, white blood cells, proteins, you got it? So red blood cells making up 50%. Higher hematocrits, although they allow you to carry more oxygen, they actually impair blood fluidity. Some of you may remember, some of you that actually were reading the medical literature or the athletic literature in the 80s. Elite cyclists were blood doping. Not an unfamiliar chapter in the history of that sport. They were blood doping, giving themselves autologous transfusions. That's where they would get their own blood reinfused into them. It would help them carry more oxygen, helping their performance, but the price was it worse than their hemorheology. The best guess is that some 20 or more individuals, these are elite cyclists, died from the consequences of poor blood fluidity, literally having strokes or heart attack during races or immediately following races. Presumably, they got a bit more dehydrated during the race. Their blood was already less fluid. They had given themselves all these extra red blood cells. Their hematocrit was elevated and blood flow suffered. So it could be life-threatening when you have too high a hematocrit and poorer hemorheology. What about viscosity? Well, got some water here. And water, as we drink it, goes down very quickly. It's because it's a fluid with low viscosity. The message is the lower your viscosity of your blood, the more fluid it flows. Optimal hydration, very important part of that equation. The third point on here, you see the erythrocyte or red blood cell and its tendency to aggregate or clump. There's a number of things that can predispose to clumping of the red cells. Anything that does that is going to make the blood flow less fluid, especially through the tiny blood vessels, the capillaries. And then there's a plasma factor known as fibrinogen. It's a clotting factor. It's a protein. Higher levels of this worsen blood fluidity. All of them increase your risk of stroke. I went through that list. This is not an exhaustive list, these 4 factors, but consistently, whether we look at stroke, whether we look at heart attack, and I'll just show you a graphic here. This is a study of these Methuselah factor or hemorheology components looking at risk of heart attack. And I want you to see here that if you look at something like fibrinogen, that clotting protein, or viscosity, you compare, in this study, they were comparing people in the lower 20% of the population with those in the upper 20%. So think the worst 20% versus the best 20% when it came to these different values. If you're in the best 20% with the lowest fibrinogen levels, you had only like 1/4 the risk of having a serious heart event of someone who had worsened levels of fibrinogen. Again, this is not looking at small outliers. This is looking at basically, roughly 20% of the population. You'd say, well, hey, a quintile, that's exactly 20% of the population. You get my point, though. Whether it's viscosity, whether it's fibrinogen, then you see here on the far right, you see WBCs or white blood cells. Higher white blood cell counts also increase your risk of, in this case, ischemic heart events, but it's because, at least partially we think, due to the way that higher white counts actually worsen blood fluidity. And that's just, all these things are linked to poorer circulatory health. Okay, straightforward, stroke, heart attack, these are circulatory diseases. But if we were to look at mental and physical performance, this is a really interesting research. Also, we included that in the Methuselah Factor book. This was looking at elite athletes. These are rugby athletes in this particular study, and they made measurements that actually had a bearing on hemorheology. They looked at red blood cell flexibility. Maybe I should just take a minute and explain this. Your capillaries, the tiny blood vessels in your body, are smaller in diameter than your red blood cells. So you say, well, how can a red blood cell that's larger than a capillary get through? Those of you that have studied microcirculation realize it's because the red blood cells actually fold over on themselves and squeeze through the capillaries. If the red blood cell is more rigid, it cannot do that as well, or may not be able to do it at all. That impairs optimal microcirculation. And what they found is that if you had poorer red blood cell flexibility, you had poorer leg muscle strength. They looked at plasma viscosity and looked at your ability to do aerobic work. Worse plasma viscosity, worse physical performance. And then a really interesting connection here, fat mass. Fat cells are not just storage cells for body fat, they actually are biologically active cells. They produce pro-inflammatory compounds. They actually predispose to worsened blood fluidity. And they found even in athletes, if they're carrying some extra body fat, that makes their red blood cells more likely to clump, presumably because of these inflammatory factors. And then that actually impairs things as specific as grip strength. So we could go down the list with all of these factors that we talked about in the book. You can see the list here again. Cancer, a very interesting one. I don't think I threw any slides in here in the interest of time, but let me just explain the connection with cancer. Some of the research links these blood fluidity factors actually to primary cancer, to the development of cancer, others to the risk of metastatic cancer. One very interesting study that we featured was done in women with female cancers. And they measured blood viscosity prior to undergoing surgery for ovarian cancer, for example. They found that blood fluidity was a predictor of survival, not because these women were having more clots. It's true, those women that had worse blood fluidity, they were more at risk for having thrombosis or clotting in their blood vessels after the surgery. But this was a predictor of overall survival. And when the authors said, well, why would this be? They concluded that poor microcirculation actually predisposes you to metastatic disease. And what their hypothesis was, if you're not getting adequate oxygenation to your tissues, if there's not good blood supply to the microcirculation, then when you have a cancer, the current thinking is that that cancer, at least many cancers, are putting off cancerous cells into your bloodstream. Normally, your immune system would gobble them up. But if they get into an area with poor blood supply, they might be able to set up camp before the immune system can get them into check, and it can predispose to metastatic disease, obvious than others. But the point is, this is just really important stuff. It's not just something I dreamed up one night because I couldn't sleep. This is very well documented in the research literature. Our book has, I think, over 300 scientific references. So, and this is just the tip of the iceberg. So bottom line, really important stuff. We want to say, well, what about the current topic of interest, which is COVID-19? If you're interested, my YouTube channel, Compass Health Consulting, I know this link will do you no good, unless some of you have photographic memories and like to type these things in. But the missing link videos were basically a series of videos, free videos that we put out saying we need to think about this Methuselah factor. We need to think about hemorheology. It may be the missing link to getting your blood pressure under better control, or preventing diabetic complications, or preventing the ravages of cancer, or improving your physical performance. But the last video that we did, actually we produced after the book came out. So the book came out in 2019, before COVID-19. But I looked at some of the research literature linking COVID-19 potentially with circulation. Now we've been hearing a lot about this, haven't we? So I did this presentation early as some of the data was emerging, but a lot of the complications of COVID-19 are circulatory. It's not a respiratory disease that often kills people. It's a circulatory disease, and one of the places it especially hits the body is in the lungs. I think many of you know the name of Dr. Seheult. I think he's one of the more reputable sources on the internet. It's kind of looking at integrative lifestyle medicine as well as conventional medicine as it relates to coronavirus. And in this particular presentation, update number 75, he's got over 100 coronavirus updates. He tackled this subject of these microclots in the lungs that seem to be one of the major causes of death in coronavirus patients. So again, it brings us right back to the topic of hemorheology, blood fluidity. So whether you just want to take it at those summary statements, or whether you want more material, we have those in our free missing link videos. We wanted to go a step beyond just telling people that this Methuselah factor is important. And the book, the last 30 chapters in this book, the Methuselah factor, actually give a 30-day program for people to put into practice to improve their hemorheology. And this is really not a sales pitch, because we have all an earlier version of the videos available for free. And so we have 30 daily tasks. There's different challenges each day during the course of a month that we encourage people to continue. Let me just open up the book randomly. I just opened up to a chapter that says, be humble. You say, be humble. Yes, we actually look at a variety of lifestyle factors, including humility, kindness, stress management. That just happens to be that chapter. How do you incorporate some of these social and spiritual factors into the equation? Here's another chapter. What is this one looking at? This is called Go Green. Now, you say, well, that's obviously about the environment. Well, we do talk about environment and how that can impact your blood fluidity. But this chapter, well, let me just give you the daily challenge. This is day 19 in the 30-day program. It says, eat more green vegetables daily. Consider fasting 1 day per week, eating only leaf, stem, and flower vegetables. If you have a question about that, we can discuss that. It's a form of intermittent fasting that I've used with patients over the years. But the point is, there's these specific tasks, and we have them. We release this in a series of videos that actually built on an earlier book that I have called 30 Days to Natural Blood Pressure Control. So the original set of videos looked at these Methuselah factor principles, but targeted high blood pressure and diabetes. And that's freely available on our website or on YouTube if you're creative and can spell my name right. So as we wind up this kind of overview portion of the presentation, we want to leave plenty of room for questions. Sometimes I've said, well, if you take all these 30 tasks in the Methuselah Factor book, could we group them into maybe 10 overarching strategies that can improve blood fluidity? And let me look at least a few of those with you. The first one I want to tell you about is one that is not on most people's radar screens for their own health. It's donating blood. This is quite interesting. We have a number of studies in the book, including a fascinating one I first learned about when we were researching natural treatments for high blood pressure. Researchers in Europe found that individuals who donated blood 4 times a year on average had blood pressures that were 10 points lower than their peers. And it's felt that what's going on here, at least among other things, is improvement in blood fluidity. So blood donation we speak about as one thing that can improve your Methuselah factor, and it can help other people. So that's something nice. Second one, drinking more water. It's surprising to me as a physician how few people keep hydrated well enough, and how many people over the years that have given me a whole list of things, whole list of problems that have improved or vanished by drinking more water. Some people with allergy symptoms, just drinking more water dramatically improves their allergies. People with headaches improve by drinking more water. And of course, things like high blood pressure and actually even, this is one that people have a hard time wrapping their minds around. Many people who have, we would say, more benign fluid retention, drinking more water actually can help them retain less fluid. You say, how would that work? What happens when you drink pure water with no sodium in it is you actually, once you tank up your body fully, you actually start to lose the water you drink, obviously, but you cannot make urine that has no sodium in it. In other words, all urine has some sodium in it. So if you're drinking pure water with no sodium, you drink an abundant amount of water, that gets rid of additional sodium that can pull additional water with it. Now, to a certain extent, that can be good. If you're healthy and you're not on medications, you can probably drink as many as 3 gallons, maybe even more, before you get into serious problems. But the serious problem you can get into, if you're losing sodium in the heat of an athletic event, or if you're drinking just copious amounts of water, is you can actually wash out so much sodium from your body. It's called dilutional hyponatremia, that you can die. So you can use this to good effect if you're a poor water drinker and you're troubled by some fluid retention, you don't have kidney problems or heart problems. Drinking more water can actually help you with that as well. So we could go on and on with some of the benefits of better hydration. Not all of them are directly related to improved hemorheology. I don't want to take too much time with some of these studies, but this is a study, I feel it's like a classic study, nearly 20 years old now. Dr. Jacqueline Chan and colleagues at Loma Linda University just looked at a very simple measure of water drinking, comparing people who are drinking less than 2 glasses of water per day with those drinking more than 5. And you can see here about a halving, cutting in half the risk of fatal heart disease. Drinking other fluids was not protective, in fact, increased risk. So the other common fluids that are consumed, we're not presumably talking about an herb tea or hibiscus tea or something that we recommend in our blood pressure book, but the common fluids that people drink. You might gather they're things like soft drinks and other things that are not health enhancing. Yes, these things actually worsen blood fluidity by direct measurement. By the way, one of the things that worsens blood fluidity is caffeine. And I think we're going to hasten over. I do have, let's just put it this way. A few years back, I gave a 6-hour series on hemorheology to health professionals. It was a continuing medical education series. So I've got lots and lots of slides about hemorheology, and we do want to prioritize your questions, but let me just kind of fast forward a ways here and come down here to some other things that would be worth highlighting for you. I don't want to talk too much more about beverages. Let me just go through these other 10 points for you and still have ample time for your questions. So plant foods are really the winners when we talk about blood fluidity, and it has to do primarily with what we call phytochemistry, the phytochemicals. Many people seem to think that these phytochemicals are things you've got to go to the health food store to get. It's true, you can get these things isolated, whether they're lycopene or resveratrol or zeaxanthin or lutein or hundreds of other phytochemicals have been identified. But phytochemicals all come from plants. And if you eat more plant foods, you can benefit your physiology in multiple ways. And give you some examples of things, and I'll just show you some of the connections with blood fluidity as well as other conditions. So these are the anthocyanins, and I like to think of my grandfather, Santo. He grew up in Italy. He died in his 90s, but I'm convinced he never had heard of anthocyanins. The good news is, even though he never heard of them, never bought an anthocyanin supplement, I'm pretty confident of that, he got lots of anthocyanins. And as you're looking at the list, you're saying, well, yeah, he grew up in southern Italy. He ate lots of tomatoes, lots of grapes, lots of onions, lots of garlic. And so the point is here, these phytochemicals have powerful benefits. Well, what are they? Here's just a partial list. Anything that's an antioxidant. Oxidative processes tend, in general, to worsen blood fluidity through a number of mechanisms. Anthocyanins also have direct effects on circulation, relaxing blood vessels. They're anti-inflammatory. And you can see here some of their other benefits. Actually, evidence that they can activate cartilage repair in people that have arthritis and have some cancer preventive properties for a number of cancers. So we could just go through dozens of these phytochemicals, and that's why when we put together the Methuselah Factor program, giving people daily tasks, some of the tasks feature eating more plant products several times in the series, and we could talk with Prophet about many of these, whether we're talking about curcumin and turmeric that has, again, direct hemorheology benefits, decreasing platelet stickiness. One of the other things I'm interested in about curcumin, it has heavy metal chelating properties. That means it can bind heavy metals in your body and help eliminate them. This is becoming more and more important because as we look at risk factors for dementia, one of them actually that's off most people's radar screens, I was reminded of this dealing with a patient this week, is high blood pressure. So if you're not controlling your blood pressure, you're putting yourself at higher risk of dementia. But another risk factor for dementia is higher heavy metal exposure. Now, a lot of people say, well, that's why I stay away from, cadmium and stuff like that. Well, actually, one of the heavy metals that increases the risk of dementia, at least in some of the research, is iron. So you need iron to make hemoglobin, to have an adequate hematocrit, but we've been seeing too high a hematocrit, bad for blood fluidity. Iron is also a pro-oxidant. So just some interesting connections there. Curcumin seems to have a number of benefits, and again, that's just a partial listing. Again, lots of phytochemicals. I don't think we're well served just by going through these. You can read medical reviews on these various phytochemicals, fascinating stuff, and has been correlated with improvement in many of these conditions that also are improved by benefiting your blood fluidity. So back to the list. We're talking about things like donating blood, drinking more water, eating more plant foods. Those were our first 3 points, things you can do to improve your blood fluidity. Here's number 4, achieving and maintaining an ideal weight. So weight loss, if you're carrying extra weight, a huge thing to improve blood fluidity. And of course, usually we think of that equation, calories in versus calories out, but we're now learning the importance of meal timing. So we do include a modified fasting approach in the Methuselah Factor book, because this not only has direct benefits on blood fluidity, but also can help with weight loss. And you can see here, the more weight you carry, even in, this has been shown even in athletes, higher inflammatory markers, higher fibrinogen, worse plasma viscosity. So everything that makes your blood fluidity worse tends to get worse the more pounds you carry. And like I said, these things are not just found in people that are carrying lots of extra body fat, but they're found as well in people that are fit, but could trim down. So losing body fat improves blood fluidity for all of us, whether we're athletes, whether we're fairly trim, but really keeping fit is a very important part of optimal hemorheology. And you say, well, that leads us to the 5th point. Whether you lose weight or not with exercise, exercise improves blood fluidity. A lot of research looking at the far-reaching benefits of exercise has definitely got to be on your program. And in the Methuselah Factor book, we recommend several specific exercise strategies. One of the ones I like best is grip strength exercise. Just doing a simple grip strength exercise for about a half an hour a week, spreading it out several times throughout the week, has been shown to dramatically lower blood pressure, for example, and it has been shown to improve blood fluidity. So it does not mean that you've got to do hours and hours of exercise, although that's better. A number of hours a week is better than a number of minutes, but doing something is better than nothing. Let me hasten down through this. I don't want to spend much more time talking about exercise because I do have a number of slides that we could deal with that topic, but I want to move down to going through our other points, and then we're going to take your questions, okay? So this one may seem like a silly thing to put up to people who would come to a lecture like this, because you're obviously interested in your health, so it is not very likely that you're using tobacco or smoking. Now, I have many friends who are Native Americans who use tobacco ceremonially, and we won't have that discussion tonight, but I'm speaking about addictive commercial smoking. Nicotine, just not good stuff when it comes to blood fluidity. research really interesting, looking at some of the end stage effects of poor hemorheology. One of them we've been talking about is dementia. And so you can measure these hemorheology impairing factors, white blood cell count, fibrinogen, they get worse with smoking. And even one cigarette will do this. Look at it when you put it side by side with Alzheimer's disease. And this is a particularly good meta-analysis, 19 studies that looked at thousands of people with dementia. And basically what they found, pretty straightforward. If you look at someone right now at this point in time, if they're a smoker, dramatically increased risk of having Alzheimer's and a dramatically increased risk of having the other common form of dementia, which is vascular dementia, both linked, nearly a doubling of risk if you're smoking. And even over time, if you have no dementia right now, so at one point in time, look at those individuals, if they're smoking, much greater risk of dementia, even if they don't have dementia today, as they continue with the habit of smoking, dramatically increased risk of cognitive decline. So if you want to keep your mental faculties, stay away from all forms of nicotine. That would include vaping, that would include chewing, as well as smoking. Vitamin D, you've been hearing a lot about it. Very important for optimal blood fluidity. Also getting a lot of attention now because of connections with COVID-19. We've known for years about the immune system benefits for vitamin D. Very, very important, especially as you get far from the equator. Up in Toronto, I would guess, haven't looked at a map lately as far as what your actual latitude is up there, but I'm guessing a good 4.5 months of the year, you cannot make adequate vitamin D. You are dependent on taking a vitamin D supplement. Closer to the equator, yes, you can do fine if you get out in the sun enough, but as we get older, as we carry more weight, so many people that I see, even people that look very tanned, some of them with low vitamin D levels. The darker your skin pigment, well, you're fortunate, you're less likely to get skin cancer, but it's harder to make sufficient amounts of vitamin D with short exposure. So many of us benefit from vitamin D supplementation, and many of us benefit year-round. We've alluded to some of these connections with overweight and making it more difficult to make vitamin D. This gives you a list of some cities that have been studied and how much time of year they face where they cannot make adequate vitamin D. You can see there, you get up to Bergen, Norway, which happens to be where my wife's father was born. Fully 6 months of the year, they cannot make adequate vitamin D. I lived in northern New England, up in Maine for a while. I found it very interesting. The old Mainers, they told us that by and large, their parents made them do something that they did not like during the winter months. You probably could guess. It was to take cod liver oil. Now, they didn't apparently connect all the dots because they didn't know, but cod liver oil is a rich source of vitamin D, and obviously over the years they observed the kids apparently stayed healthier if they had a source of vitamin D in the winter. Just an interesting illustration. Get adequate sleep, very important for blood fluidity. If you don't get enough sleep, it ramps up your stress hormones. That's how you function the next day, whether you took caffeine or not to get you going. If you're not getting enough sleep, you are having to boost levels of stress hormones that actually increase inflammation and make blood fluidity worse. This has been well studied. Just an aside, vitamin B12 does seem to have some anti-inflammatory properties. Another vitamin that I commonly see as deficient in large numbers of the population. So if you're a clinician like I am and you're checking people's blood levels, you'll see that B12 and vitamin D are often deficient, especially as people get older. Dental health. If we have any dental professionals with us, thank you for your service to us, really. If your dental health is not good, if you have gingivitis, gum problems, you will worsen blood fluidity. And then the last point I'd like to leave you with, which is number 10 on our list, is to control stress. A lot of people say, why is this a picture illustrating controlling stress? I was giving a lecture a number of years ago and was staying with some folks. They had some young children. We were using them as our focus group. They said, this boy looks very stressed. And I didn't probe as to why they thought this. Maybe his mother said, drink only water. And he's trying to figure out how to do that with 3 straws in his mouth. Well, I try to give you an overview of the subject of hemorheology, the science of blood fluidity, and tried to give you some of the things that we've been recommending over the years to help people improve their blood fluidity. With that in mind, it's time to take your questions. So, George, I'm assuming that you're going to be reading questions maybe to me, sorting through them.
Yes, thanks, Dr. DeRose, for sharing the information. And it was really interesting to learn about a topic that we really are not very familiar with. So thank you so much. We do have some very good questions, so we want to try to get to as many as possible. And those who shared questions, thank you so much. And as we go through this session, continue to ask your questions. We are going to cut right at 8 because we want to respect everyone's time, but we will try to get to as many as possible. All right. So Dr. Rose, first there's a question from Dina. It's a really, really good question, actually. We know that lower fat diets might be a little bit more associated with good health. So the question is, how about plant fats like avocado, nuts, seeds, and soy products when consumed even with other non-fatty plant foods like salad or beans and rice cause blood flow to slow down? So how about like quote unquote healthy fats? How about that? What's your thought?
Yeah, so I mean, one of the things that does impair blood fluidity are triglyceride levels, and it is true when you consume fat, that does affect blood fluidity. So regardless of what the source of the fat is. Having said that, though, there's kind of an interesting connection here. If your overall health is good, mild stresses on the system are not necessarily bad. They may be beneficial. The good thing that fats do is they actually help to stabilize blood sugar. And one of the things that is associated with poor blood fluidity is higher levels of insulin resistance. So I do recommend including healthy fats as part of the diet. I think that is in keeping with a healthy lifestyle, but you do want to include that as a broader part of a healthy diet. We don't just recommend having an avocado and walnut meal.
Right.
Okay.
All right. There's a question from Samantha Jones. Thanks so much, Samantha, for asking your question. So I think this is regarding your point about COVID. So it says, what makes coronavirus a circulatory problem rather than a respiratory problem? Please address effectiveness of our current standard protocols with sanitization, masks, and PPEs.
Okay. So we're not talking about transmission. It is transmitted through the respiratory route, but we're speaking about the complications of COVID. And what's happening is, it relates to the receptor that's being used. We've heard a lot about the ACE2 receptor, but those are also located on blood vessels. And one of the best explanations that I've seen, by the way, Dr. Seheult, who I mentioned earlier, does an excellent job explaining this in a number of his videos. It actually can trigger the release of something called von Willebrand factor. Von Willebrand factor is a factor that worsens blood fluidity. So the infection with COVID-19 actually causes damage to the blood vessels that triggers the release of a factor that worsens blood fluidity and then causes microscopic clots. One of the places that it happens is the lungs, and therefore this can contribute to the breathing complications that we see in severe COVID-19 infection.
That's great. You point that out. People only think it's in your lungs, but that's not true, right? So that's
That's right.
and thanks so much, Samantha. That's a great question. Next question from Marva Chase. It's actually a very interesting question. She says, just yesterday, I was reading online about blood thinners. The article mentioned that blood thinners may be beneficial to those who are on them or using them during COVID-19. Is there any truth to this? And I guess overall for blood health as well.
Yeah, no, most definitely. Not in general as far as health. We don't recommend just putting people on a blood thinner. But because of this pro-coagulant effect with COVID-19, I work in primary care. I'm not dealing with COVID patients as far as treating them in the hospital. But my colleagues that I speak with, they're routinely now treating people with anticoagulants when they come in with serious COVID infection. And this does seem to be increasing survival. At least that's the impression.
Right, great. This is a very it's an interesting interesting question here. Very simple. Would applesauce have the same benefit as whole apples?
No, it's a great question. It's a great question. I do enjoy applesauce, homemade applesauce. My wife has canned a lot of jars over the years. But I will tell you, as far as the glycemic effect, years ago, probably back in the 80s, if I were to guess, in the British journal, The Lancet, they compared the same number of calories taken in the form of apples, compared it with taken in the form of apple sauce, compared with apple juice. And they found very different effects on your blood sugar. So we speak about glycemic load or glycemic index, and we speak about insulin resistance and some of these things that affect blood fluidity. You're much better off eating whole foods predominantly. Now, apple sauce, made from whole apples, that's still a good food, but um, the more you chew your food, the better. These modified fasts where people are drinking beverages, they have a number of downsides, and one of them is swings in blood sugar.
Great, great. Thank you. Now, this is going to your comment on iron. So it says, how about iron when you are chronically anemic?
Okay, so yeah, don't misunderstand my point, and this is on me, not on you. So let me make sure I'm clear, we're clear with this. You do need iron. We don't want you on a zero iron diet. You need iron to make adequate blood cells. Your body is pretty good at recycling iron, but when we're during our reproductive years, at least those of you that are women, you're losing iron every month. So the issue is, yes, it's important to keep your iron level adequate. But what the research suggests is on a typical Western diet, most people are getting more iron than optimal. It's having these procoagulant and pro-oxidant effects. And this is presumably one of the reasons why blood donation is beneficial. It's getting rid of some of that extra iron that you don't need.
Great, great. A lot of good questions here. Back to Samantha. So this is actually a very good question. Something actually I have thought about as well. The question is, I read that to help the absorption of turmeric, you should combine it with black pepper. But Ellen White talks about black pepper because it makes the blood feverish. I'm torn about understanding this topic. Could you help?
Yeah, there do seem to be things that increase the bioavailability of different compounds. The amount of black pepper extract that's used in these curcumin supplements is really quite small. And turmeric itself has some digestive irritant effects, so we don't recommend people just loading up on it, but I have not seen a problem with using the turmeric. We recommend in our blood pressure book, not using more than 2,000 milligrams a day. A lot of people use far more than that and don't have problems. And I don't see a problem with using the black pepper extract or other compounds that can enhance the bioavailability of it.
Right. This is a related question. It says, what's the best way to take turmeric, in the pill form or as liquid?
Most people take it, as the powdered herb in a capsule. That's usually the easiest for people. And the typical dosage would be 500 milligrams 3 times a day. So that's commonly how it's consumed.
All right. This is an interesting question here. So this is from MY. Could you please explain patterns you see in persons with poor methylation, those with double homozygous MTHFR, double variants of COMT? And are there natural ways to correct this that are not methylated forms?
Okay. So this is a pretty deep question, and it's a
Yeah.
good one. It has to do with this methylene tetrahydrofolate reductase gene that's involved in methyl transfer. For those of you who are not familiar with this, uh, they're important vitamins, important systems in your body. They're involved with these methyl groups. And vitamin B12 is involved in this, as well as other compounds. So I have not really looked into connections between this subject and hemorheology. So I will tell you, this is one of the questions that I'm going to say is beyond my knowledge base at this point. But I definitely think it's worth looking at. I just haven't looked at it.
Great, thank you. Um, this is regarding your donating blood. Regarding the first strategy of donating blood, is this still suggested for those with iron deficiency? I donated once when I was in the early 20s. for the entire 2 weeks. I was strangely so tired, exhausted. Um, yeah. So
Yeah, in most blood banks, I mean, they have pretty strict criteria as far as whose blood they will take. If you find your hemoglobin runs quite low, for example, you are a woman during your reproductive years and you tend to run anemic, donating blood, well, think about it. You're basically donating blood every month. I'm saying that's somewhat, I don't want to say euphemistically, but it's really, you're losing blood already. And you may not be able to donate blood, and you may not need to donate blood to get that same benefit. So it really applies to people who are running the higher hemoglobins, higher hematocrits, where we seem to see that benefit.
okay, great. This is a question from Caitlin. This is a good question. So, is vitamin D still used effectively when you're taking it from supplement forms, not naturally from the sun?
Yeah, vitamin D seems to work just fine if you take it as a supplement. It is a fat-soluble vitamin, so in general, we recommend people take it with something that's fatty to enhance absorption. Some of the powdered pills may not be absorbed all that well if you just took it with water. So take it with a meal with something fatty. And the vitamin D that's made by your body is vitamin D3. Uh, Vitamin D2 seems to have similar activity. It's not identical to D3. So if you really want to take what your body makes, you would be taking a D3 supplement. The other name for it is cholecalciferol. That's the chemical name for it.
Yeah. Okay, this next question, you can answer if you want to or you don't have to, but it says, you mentioned giving blood 4 times a year. My son donates blood plasma and was told that he can do that safely every week. Does this seem excessive and dangerous?
The research that I've seen that makes this connection between improved blood fluidity and blood donation is with donating whole blood. And again, I'm thinking that one of the main reasons is lowering the iron level, whereas plasma, of course, has no iron in it. So I'm not saying it's not something good to donate as far as helping your community, but I haven't seen any evidence clearly that that would help with blood fluidity. It may be lowering fibrinogen levels or other things, but I just haven't seen anyone look at that, measure it.
Great. Okay, cool. This is from MY again. This is going to water now. So could drinking alkaline water distilled with reverse osmosis and eating a mostly alkaline diet lead to better hemorrheology? If so, can changes be observed in the blood in hours, weeks, or months? Maybe I'll add, is there anything to like better types of water, Um,
Yeah, well, I definitely advocate drinking water as pure as possible. We do get our water from a system that is, reverse osmosis and filtered beyond that as well. So I am concerned about things that are in our water. So I do think it's wise to do something to purify the water. Even most municipal sources. We did have well water in one location that we had checked that seemed to be, pretty much like spring water. That could be fine, but make sure what you're drinking is checked. As far as the alkalinity of the water, uh, I have looked into this some. The only study I've found that suggested any benefit, at least in the medical research literature, was in athletes. There may be some evidence that drinking alkalinized water during endurance events may help because you're making, lactic acid. There may be some performance benefit. But as far as these far-reaching benefits from drinking alkaline water, I haven't seen evidence for that. But having said that, a lot of these alkalinizers, they're very excellent filtration systems. So the water is probably very good quality. You may be feeling better with it. I'm not saying it's bad. I'm just saying that some people have made claims over the years for these things that seem to be unwarranted, at least based on anything I could find.
right, right. All right, we're running short on time here, so I'll get to a few more. Sorry if, in advance if I cannot get to your questions. This is from Mrs. Santos. So thank you, Mrs. Santos, for your question. So the question is actually regarding eating for your blood type. Is there anything to that?
Not much to it. Not much to it. COVID, of course, does have relationships to blood type. There are minor things, ulcers, but really a healthy lifestyle, pretty much similar general principles. A lot of the eat right for your blood type stuff is not really on track.
Yeah, I agree. Yeah. All right. This is from Lee Willard. Thank you, Lee, for your question. It's actually a very interesting question. I cannot take turmeric capsules. It hurts my stomach really bad. So can I get enough just using it in cooking? So turmeric versus like, curcumin and stuff like that. Like so
Well,
it's
sure. I mean, this is where historically people were getting turmeric in their cooking, and it is one of the known problems with turmeric. Some people it does have a gastric irritant effect, and so taking it with a meal is definitely the way to do it.
great. And we're gonna take here probably our last question. So this from Deborah Dushooter. Sorry if I didn't say your name properly. It's actually a really relevant question. How do you build up your ferritin if you've been taking iron for a long time and not seen improvement? I think many people experience this.
Yeah, so ferritin is a storage form of iron. It's also an acute phase reactant. That means if you get sick, your ferritin might go up and your iron storage is not getting better. But basically, what I would say is try to eat more dried fruits and vegetables, and take vitamin C in conjunction with the iron. That can enhance absorption.
Great, awesome. So it is nearing 8. We want to respect everyone's time. Just to close off here. So these are the 3 books that Dr. DeRose has written. You can buy them on Amazon and so forth. So you can easily obtain these. So these are 3 books for you to consider getting. You can also listen to more of Dr. DeRose's talks on a few places. So audioverse.org. You could just type in Dr. DeRose or David DeRose in the search, and you could see some of his talks there. Also, his YouTube channel is Compass Health Consulting, where you can find information there. We have other webinars coming up. Our next one is on actually exercise, immunity, and COVID-19. How exercising can help optimize our immune system, so we could so that it could help with COVID-19. So that's September 27th, 5 to 6 p.m. We want to encourage you all to register for free for that one as well. So thank you everyone for coming. Thank you so much, Dr. DeRose. It was very informative. We really appreciate it. You can find the recording for this on our Facebook page and also on our YouTube channel, Lifestyle is Medicine Institute. And you can find the recording for this there, and you could re-listen to it or share it. We want to encourage everyone to share it with your friends, loved ones, so they can get the information as well. So thanks again to everyone. Thanks, Dr. DeRose, for coming. Have a good night, everyone, and we hope to see you again. Thanks so much, everyone. Good night.